Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Andrea Lorio, a pulmonologist and the Director of Pulmonary and Critical Care Services at Terrebonne General Health System, and Hannah LeBlanc, who's a patient navigator with Terrebonne General Mary Bird Perkins Cancer Center. Today we're going to be discussing Lung Cancer Awareness Month. Thanks for being on the show, ladies.
Hey, Rhonda. Thank you for having us.
All right, well, let's get started with you telling us a little bit more about yourself. Dr. Lorio, you go first.
Sure. I'm Dr. Lorio. I'm one of the pulmonologists and critical care specialists at Terrebonne General. I've been here in the Houma area for about 7 years and providing care to all of our patients.
Okay, and Hannah?
Hi, I'm Hannah LeBlanc. I've been employed at Terrebonne General since 2015. I am a respiratory therapist by trade, and now I work in the Cancer Center as our lung navigator.
Hannah, why is Lung Cancer Awareness Month so important?
So it's super important because lung cancer is the leading cause of death worldwide in adults.
It accounts for about 1.6 million deaths per year annually, and survivalship is less than breast cancer, prostate cancer, and colon cancers combined.
Okay, what are some warning signs and symptoms of lung cancer?
So early lung cancer can be completely asymptomatic, meaning there are no symptoms to tell you that cancer is present. As cancer develops, symptoms can be local, related to pain, cough, shortness of breath, and as it spreads throughout the body can include unintentional weight loss and fatigue.
Okay, are there ways to prevent lung cancer?
The biggest way to prevent lung cancer is to reduce risk factors for lung cancer. So a lot of prevention includes reducing smoking personally and secondhand smoke exposures.
Okay, since you said some people don't even know that they have it, is there a way to detect lung cancer?
So we do a screening here at the hospital. It's called a low-dose CT screening, and this is an early way we could detect lung cancer for our patients who are smokers or former smokers.
Okay, and can you tell us more about the program that Terrebonne General does offer for lung cancer?
So Terrebonne General's lung cancer program encompasses not only prevention techniques. We go out to schools to help with smoking prevention, as well as offering smoking cessation for current smokers. And our team includes both the pulmonologists and oncologists for those that are diagnosed with lung cancer. The low-dose screening program starts in your primary care doctor office or in our office and is coordinated by Hannah here. We make sure that everybody who's eligible for a low-dose CT scan is offered one to help prevent and identify early-stage lung cancers.
Okay, and what is the criteria for the program?
So you have to be, like we said, a former smoker or a current smoker within the last 15 years. You have to be between the ages of 50 and 80 and have at least 20 pack year history of smoking or more.
Okay. How does this benefit the patient?
Early identification of lung cancers when present is the number one way that we can offer a patient a curative treatment, either with radiation therapy or with surgery. There are a lot of studies that show that early detection of lung cancer can increase 5-year survivorship up to 92%, whereas when symptoms develop and cancer is unfortunately at the later stages, 5-year survivorship can reduce all the way down to 12%.
So that's why y'all are here today to tell us about how important this screening is.
Absolutely.
Right, super important.
Okay, so Hannah, every year on November 16th, the American Cancer Society sponsors the Great American Smoke Out. Can you tell us how Terrebonne General is going to be celebrating that this year?
Right, so we are super excited. This is the first year that we'll be educating about the Great American Smoke Out. So this year we'll be in the foundation room downstairs here at the hospital, and we are going to be educating the visitors and also all the employees about smoking cessation, our lung program, as well as low-dose CT. So we'll be there most of the day educating and handing out popcorn so people could come visit us and get some popcorn and learn about what we have to offer.
Okay. Dr. Loria, what is the main takeaway you'd like people to know today?
Lung cancer can start silently, and so early detection is key for bettering your health and survivorship for not only you, but also your families.
Okay. And Hannah, tell us how someone can schedule an appointment or learn more.
Right, so they could call our office and either ask for me, the lung navigator, or ask for further assistance.
All right. Well, thank you for being on the show today and sharing this helpful information.
Thank
All
you
right.
for having us, Rhonda.
Thanks.
To learn more about Terrebonne General Health System and lung cancer screenings, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.